Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Monday, December 14th, 2020. I'll keep my comments brief, as of course the Minister and I are in the House of Assembly shortly, and we want to leave times for appropriate questions. This is the start of a very exciting week. The very first doses of Pfizer's COVID-19 vaccine landed on Canadian soil late last night. And our logistics team is working diligently on the next steps as Newfoundland and Labrador gets its shipment shortly. As we announced last week, the Health Sciences Centre in St. John's is one of 14 vaccine distribution sites chosen across the country. Major General Danny Fortin, who is leading logistics at Public Health Canada's Operations Centre, has said the vaccine delivery schedule is unfolding exactly as planned. Our own logistical dry runs concluded last week, and everything is in order here in the province. The health and well-being of Newfoundlanders and Labradorians is our top priority. It's top of mind for public health departments across the country and Health Canada. That's why we can all assure you that this vaccine has proper approval after a rigorous scientific review. Canada is the third country to greenlight this vaccine around the world. The limited side effects noted during clinical trials of Pfizer's vaccine are similar to those experienced with other vaccines that you may be familiar with. And people need to be educated and aware of the side effect profile. Those side effects, even though they're limited, can include pain at the site of injection, body chills, feeling tired and fatigued, and even feeling a bit feverish. These effects will resolve on their own and do not pose a risk to your health. We encourage everyone to avail of this vaccine when their time comes. And when it comes to concerns about allergic reactions, I'd like to stress that Health Canada warns that all vaccines carry a warning about the risk of serious allergic reactions. In terms of Pfizer's COVID-19 vaccine, people with allergies to any of the ingredients in it shouldn't get it. Not anyone with allergies, just those who are allergic to the ingredients in the vaccine itself. It's a big relief to be able to start rolling out the COVID-19 vaccine right here in Newfoundland and Labrador, and indeed the rest of the country. But we're not out of the woods just yet. It's incredibly important that now, more than ever, we continue to follow public health guidelines. Remember, the fight against COVID-19 is ongoing and active, and you are all participants in it. So please, remember, wear a mask, wash your hands, and keep your distance. The holiday season is upon us, but it's not like any we've experienced before. Be sure to keep that in your mind as you go about your daily business. Be kind. Safely check out on people around you, especially if they may be under the weather or feeling particularly tough time right now in the holiday season. Use the mental health resources available to you, like Bridge the Gap. You're not alone. So take care of yourselves and each other. And with that, I'll turn it over to Dr. Fitzgerald for today's update.
Thank you, Premier. Good afternoon, everyone, and thank you for joining us today. Since the media advisory yesterday, we have one new case of COVID-19 in our province, and it is travel-related. The individual is male in the Eastern Health Region between the age of 50 and 59. We have 23 active cases in the province, and the total number of cases cumulatively in our province is 359. In total, we have tested 67,315 people. I would like to start with an update on the situation in Harbour Breton. We have had over 500 people come forward for testing in the community, and we have not identified any additional cases beyond the existing 3, which is very reassuring. We have found no evidence of widespread community transmission in Harbour Breton to date. Out of an abundance of caution, further testing is being done in the area to ensure that there is no further onward transmission. The investigation is ongoing, and we will provide an update when it is concluded. Turning our attention now to the Western region, the positive case announced Saturday has now been determined to be inconclusive. The original sample was retested on another testing platform, and a second specimen was collected and tested, and both are confirmed negative. This, combined with the information obtained through the public health investigation, leads us to say that this individual did not have COVID-19. The public health investigation in the region has now concluded, and the investigation has not found any evidence of COVID-19 virus transmission within schools or in the community. With this new information, we no longer need to proceed with broader community testing in the area. As we enter the middle of December and prime time for Christmas celebrations, I have to say that I'm very encouraged that people are taking heed and following our guidance around gatherings. I have heard of many functions being cancelled or modified to ensure that they're in line with our recommendations. I know it seems terribly grinchy of me to express happiness at this, but I know that these measures will prevent the spread of COVID in our province, and that has to take priority over all else right now. For anyone who is still uncertain about where we are, what we are asking of you, it is that you choose a maximum of 20 people that you interact with closely over the next few weeks. These 20 people should not change. Gatherings should only be held with these close, consistent contacts. This means you should not be attending parties with different groups of people from night to night. As a reminder, our special measures order for informal gatherings sets a maximum of 20 people. This includes functions in private homes or in rented spaces when not organized by a business or organization. It also applies to informal outdoor gatherings. The number of people in any gathering should only be as large as the space permits, allowing 6 feet of physical distancing on all sides. When the size of a space is taken into consideration, this may be much less than 20. If you find yourself at a gathering with people who are not your close, consistent contacts, then you must apply your layers of protection. Please maintain 6 feet of distance from others, wash your hands well upon entering and leaving, and avoid any self-serve food trays. If you are unwell, do not attend or host a gathering. Stay home until your symptoms have passed. If you meet the criteria for COVID-19 testing, please get tested. Similarly, when in public spaces, apply your layers. Wear your mask, stay 6 feet away from others, and remember that the mask does not replace physical distancing. Do not visit public spaces if you are feeling unwell, and wash your hands often and well, or use hand sanitizer when soap and water are not available. And above all, do not forget kindness towards others. As a recap for those who may have just joined us, we have only one new case since yesterday's media advisory, and the total number of cases in the province is 359. And while we keep our eye on that small speck of light at the end of the pandemic tunnel, we must continue to persevere with our trusted public health measures. We are doing great, so let's keep up the good work. Hold fast, Newfoundland and Labrador. Thank you.
Thank you, Dr. Fitzgerald, for sharing that update. I'll now pass it over to Minister Haggie.
Thank you very much, Premier. I'll keep my remarks brief, simply because of our time constraints you mentioned with the House of Assembly opening in less than an hour. Really, all I would like to do is make 2 comments. One is that the changes to the hub have been delayed owing to some technical issues with revamping of the website. There is a test version available, but it's not yet ready to roll out, so we'll have that as soon as we can get that up and running. The second thing is I'd like to give a shout out to Eastern Health and Mr. Baird's team, who put together point-of-care trainers at very short notice and shipped machines for ID Now out to Stephenville on the highway yesterday at a time when it probably was not the day when most people would choose to be on the road. So once again, an example of healthcare staff going above and beyond to help deal with COVID as it evolves. So I think with that, Premier, I'll reiterate Dr. Fitzgerald's comment about holding fast and pass it back to you.
Brief indeed, John. I like it. A new style for these briefings. We'll hold true to the title. Okay, we'll open it up now to questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 7 reporters registered for today's call. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Jackson with The Telegram. Please go ahead.
Hi, good afternoon. Can you indicate yet whether the first round of vaccines will be administered first to healthcare workers or elderly people, or a combination of both?
So at the moment, my apologies. So just due to restrictions that have been placed on us by the manufacturer for this first round of vaccines that are going to be coming here, we're not able to move it from the point where we receive it, and so because of that, we'll be targeting healthcare workers with that group. With that lot of vaccines. However, our priority groups, as we've stated previously, are still, we still have adults living in nursing homes, and the staff in nursing homes certainly are still amongst those top priorities to get the vaccine in the first quarter.
Okay, thank you. And you referred to, the Premier, I believe, referred to people with allergies. Can you spell out exactly what people should not be getting them, including those with allergies, and what are the things that people might be allergic to in the vaccine?
So I think the ingredient that is concerning is something called polyethylene glycol, and so that's a known. Some people are known to be allergic to that ingredient, but there are, as with any vaccine, if you have an allergy to any components of that vaccine, then you should not get it, and that's true for any vaccine that is on the market at the moment. So that's the main gist there of the allergy issue, and that's what Health Canada and the National Advisory Committee on Immunizations have recommended with regard to allergies here in Canada. There's also some groups that at this time are not recommended to get the vaccine, not because we feel that the vaccine would be harmful, but more just because there hasn't been a lot there haven't been a lot of people with those conditions in the trials for the vaccines. So, you don't have the evidence really at this point. It's not to say that there will be an issue. We just don't have the evidence to support the use. And that's immune compromised people and those who are pregnant and breastfeeding.
Of course, Peter, if anyone has questions about, it's not the panel's position to comment on individuals' healthcare, but in particulars. But if people have individual questions surrounding their own medical conditions, their own allergy profiles, then we all encourage them to talk to their primary healthcare provider.
Okay, thank you.
Our next questions are from Linda Swain with VOCM. Please go ahead.
Good afternoon. Students are being sent home with their learning materials this Friday. Can we expect an extended closure over the holiday?
That's something that we're not considering at this particular moment in time, but I think it's prudent if students are going to be leaving for an extended period of time, given the uncertainty that we're seeing around the world, that I think that's reasonable to take their items home for a break period.
Is that because we're fearful we could see a little surge over Christmas with people going ahead with gatherings and such?
Well, I think it's just prudent and responsible, given the nature of this virus, as we've seen, that things can change. So if a student's going to be out of school for 2 to 2.5 weeks, then things can change in that 2.5 week period. It's just an abundance of caution that they would take their items home should things change, and the education system have to adapt accordingly.
Our next questions are from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
Thank you. The first shipment of the Pfizer vaccine has arrived in Canada. Do you have a concrete date for its expected arrival here?
Those details are all being worked on currently. We're hoping, weather pending, that'll be within the next couple of days.
Right on. And when, from the date it arrives here, how long will it take for the first person locally to get the vaccine?
It'll be as soon as possible. Certainly, healthcare teams are gearing up to be able to give the vaccine this week if need be.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
I'm hoping you can give me a little more detail about what exactly happened with the case on the West Coast. Dr. Fitzgerald, you said Saturday, but was that Friday's case that had the connection with the schools that was now deemed to actually not be a positive case? And can you explain what happened here that caused it to be positive initially?
So it was a case announced over the, I don't know, I have to go back and look exactly at the date, but no, my understanding is a case announced over the weekend, and we'll have, and what happened basically, as with any test, sometimes you can have positive results when when there isn't actually virus there, just like you can have a negative result when there is actually virus there. And so when we go through an investigation and we try to look for a source, or we try to look for reasons where this person might have picked it up and we can't find that, then we do further investigations with the testing, and we look at that as well. And so once that was done, when the initial test was done on another platform, another testing platform, then that test was deemed to be negative. So we had a positive on one platform, a negative on another. So then we retest. We call that an inconclusive, and then we retest, and that retest was negative.
So then I want to ask about the case that was announced on Friday, which was someone who was in several schools. People in the area have been very concerned about that. In fact, at the elementary school, more than half the students were kept home today. First of all, I guess, why has the names of the schools and that information not been provided, and people have essentially had to rely on social media in order to try and figure those things out?
So my understanding with the case, and of course I'm not involved on the front lines of this, Peter, but my understanding is that the risk was actually had actually passed with regard to exposure time, and so it was more about, the testing was more about just trying to find sources and to make sure there was no onward transmission, but that we were past incubation periods and things like that. So this is so in that situation, up to this point, where all the testing that's been done up to this point has not revealed any onward transmission at all.
Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi, I'd like to ask about that same situation on the West Coast. There's been a number of people who've expressed frustration about hearing that there's a positive case in their region, and then hearing rumors and having nowhere to turn for information that they can trust. Do you think that in this case, the information public health has divulged in this case has been sufficient?
So, as with any case, we are not able to release details of individual cases, and certainly the information at this point, I know that public health was in contact with schools and all the stakeholders in the area over the weekend. So certainly I think they have done a good job with communicating to their stakeholders what the information that they had.
Just to follow up on that, time after time we've seen that despite authorities trying to keep privacy in mind, people seem to find out, or there's a lot of rumors that have been circulating. If there's a case where if this information eventually comes out and there's no authority that is giving clear information on what schools are affected, for instance, in future, keeping that in mind, if there are cases where school children are close contacts, are we going to be more transparent regarding specific schools that are affected?
So we have been, and we were in contact with, the public health authorities were in contact with the English School District to have those discussions. So that did happen in this case as well. And it has in every case where that potentially is an issue.
But with parents specifically, sorry.
So communication to parents in that situation is generally a joint effort between the public health and the school district when they feel that there is concern in the schools where they feel that a school may be affected. Certainly all the people who were deemed to be affected were notified by public health with regard to testing and things like that.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. I have a question surrounding the vaccine administration. We know in this province that there will be no filming or documentation of who's receiving the first vaccine, citing privacy reasons. When we do the flu vaccines, however, we generally do, I guess, visualize that and relay it to the public. Quebec having announced those who are going to be getting that first doses, having been interviewed. Here, just what do you say to those who say that the lack of transparency on the administration of this vaccine is very concerning?
I think that stems from some comments I made last week, actually, Kellyanne. I mean, I was not convinced of a public health benefit on the evidence of the question as it was posed. The fact is that, figures in the public life, such as myself, have actually had their photo op having their flu shot in an attempt to encourage others to take vaccine. I think the concern from public health and the clinician's point of view is around the individual privacy. And I think there's always a discussion to be had. If there is some suggestion or some evidence that by having an index, vaccine zero kind of event, that we can improve the uptake. I haven't seen it, but from my point of view, I've not ruled it out. I just hadn't ruled it in on the basis of what I'd read.
But in hearing those concerns about that transparency, is that not one of, I guess, those points to be made on if people are to see this administered in our province to people here, if these people are willing to be interviewed and filmed and everything, then wouldn't that give way to that transparency?
I think that's a view, certainly, and I'm quite happy to be persuaded.
Yeah, I mean, Kellyanne, there's certainly a historic event in the province, and of course, as decision makers here, we need to weigh the risks and benefits of documenting this and ensuring, first and foremost, that the index case that is vaccinated is consented and willing to participate, not only in the vaccine, but in a public display of the vaccine. So these are all things that were being discussed internally, and we can appreciate the confidence that may be gained from such a venture with respect to the public opinion on the vaccine.
Thank you.
Our next questions are from Sarah Smelly with Canadian Press. Please go ahead.
I also wanted to ask about the public access or the media access to, perhaps some of our first vaccinations, especially given that we're seeing footage today from one of the first vaccinations in the States, in New York City. I know of parents who have, had kids come home saying, oh my gosh, this vaccination is going to be like this, and we're totally scared. And the parents will show them the videos from the UK. I also wanted to ask if there had been, if the idea had been revisited.
Yeah, so this is all stuff we're considering right now, similar and in line with Minister Haggie's previous comments and how we answered Kellyanne. But these are, you're right. I mean, if this increases the public willingness to be vaccinated and dispels mirrors and dispels myths and settles fears, and the participant is willing and able and consented to being publicly displayed, then that's certainly the things that we're considering with respect to the balance of public health measures and individual privacy.
Thank you.
I will now go back through each reporter to see if you have one final question. Peter Jackson with the Telegram, do you have a final question?
Yeah, this one quick one about Harbour Breton. The first case there happened more than a week ago. At what point do you decide to clue up an investigation, even if you don't find a source?
So I guess when public health has no further leads to follow up, then they make a judgment and decide whether they close an investigation. But at the moment, they're still working through a few paths, and I think in the next couple of days they'll have finalized that investigation.
Thank you.
Linda Swain with VOCM, do you have a final question?
I do. Day leave is being offered for residents of some long-term care facilities to allow them to spend time with family over Christmas. We're told that's causing some concern for some residents and their loved ones. What assurances can you provide for those worried about their loved ones in long-term care who feel as though they could potentially be exposed in that way?
I missed the beginning of that question, Linda. I'm terribly sorry. What was the issue with long-term care?
I'm told that day leave is being offered for some residents to allow them to spend time with family over Christmas, and that's leading to some concerns among other residents of long-term care that they could be exposed that way.
No, I hear you. Sorry, it was the day leave. I missed that. From my point of view, I think that is a legitimate concern, and we'd certainly take public health advice about that. From long-term care facilities, obviously, they fall under regional health authority control, and it's a relatively straightforward issue to manage once we have the right advice. I think for personal care homes, however, that would be up to the owner or operator, absent any directive from medical officer of health. But it is something we're looking at the moment.
Thank you. Elizabeth Whitten with All Newfoundland Labrador. Do you have a final question?
Yes, I wanted a point of clarification. Newfoundland and Labrador is getting a shipment of 1,950 doses of the Pfizer vaccine, and it's a double dose. So does that mean 1,950 people will get inoculated twice, or is it 975 people?
So it's 1,950 doses, which is enough for 975 people.
Thank you.
Peter Cowan with CBC. Do you have a final question?
Yeah, I'm just hoping for a little more clarity on the West Coast situation. That case that was announced Friday that involved students in schools, that, as far as I know, it was under investigation at the time. Has there been a source of that investigation found, or is there still concern that this may be community transmission?
No, the source of that investigation was found related to travel.
Related to travel. Okay,
Yeah.
Thank you.
Sorry, excuse me.
Patrick Butler with Radio Canada. Do you have a final question?
Just regarding vaccines, beyond the initial 1,950 doses that we'll receive this week and then 1,950 next week, are there any more vaccines? Can you give a number, if you have one, in terms of what has been confirmed for Newfoundland and Labrador and when we might expect to receive them?
We don't have those numbers yet. Those are all conversations that are happening at all three of our tables nationally. And of course that depends on how quickly supply chains can scale. And so, but those are all numbers that we're all anxiously awaiting.
Kellyanne Roberts with NTV. Do you have a final question?
I do. We're getting concerns from nurses regarding the rotational workers that support people in labor and delivery in OBS, particularly that they don't have to self-isolate. They can come directly in. With the amount of cases having been linked to travel recently, why was this decision made?
Sorry, the question is surrounding OBGY, the labor and delivery?
Sorry, rotational workers who had just returned back to the province, not having to self-isolate before being present for a labor and delivery.
So they do have to self-isolate outside of that support visit that they have for the labor and delivery. And certainly, it is important for mothers who are giving birth to have support from their support person, whoever that may be. And so certainly in discussion with the regional health authorities, putting the proper precautions in place so that the risk of spread is low with physical distancing and masking. It is felt that those risks can be managed, much as there are other situations that, where we have to manage risk in that way.
Thank you.
Sarah Smelly with the Canadian Press. Do you have a final question?
Yeah, I just wanted to ask, and pardon me if this has been covered, Northwest Territories, for example, they're giving estimates for when they think the Moderna vaccine might arrive there. Do we have any estimates for that?
No, we don't.
No, not at this time.
Not yet.
Thank you.
Thank you, everyone. Premier, do you have any final comments today?
Thank you for joining us. I just wanted to reiterate some of the discussion points from earlier. Please continue to follow public health guidelines. There is hope on the horizon with respect to the vaccines, and I'm glad that it occupied the majority of our conversation today, because people need to be educated and aware. But I also need to give a huge shout out to Minister Haggie and his team, and Dr. Fitzgerald and her team, of working through the weekend diligently on all these cases. I know that it's a stress and anxiety to people in the communities, but I need to reassure you that both of these individuals are working tirelessly at all hours of every day and night, including weekends, and they each deserve a round of applause, especially going into this holiday season. So thanks for joining, and we'll look forward to chatting on Wednesday.
Thank you, Premier. Take care, everyone. Stay safe and enjoy the rest of your day.